As the healthcare leader of the Tri-Parish community and with its Mary Bird Perkins Cancer Center at the forefront of cancer research and treatment, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community.
Welcome back to the program. As you can see, Terrebonne General Medical Center been around for a long time in this area and really on the cutting edge of technology and medical care. And speaking of that, we have Dr. Jeffrey Long, oncologist at Mary Bird Perkins Cancer Center. I guess it's close to what I said. I don't know, but
you got that right. Pleasure to be here, Jimmy.
Okay, good. It's good to have you back. And I know that right now there's a lot of awareness going on and trying to get out some awareness, and we're going to be talking about prostate cancer awareness.
We got some things to say about that this evening.
Yeah, let me, most people may know, but maybe some do not know, what basically is the prostate?
Well, the prostate is a walnut-sized gland surrounding the man's urethra.
Okay, and I guess what function does it serve from a functional standpoint, and then we'll start getting into maybe how it's diagnosed as far as cancer is concerned.
Yeah. The prostate serves a variety of sexual functions. It produces semen, and it's also helps affect the urinary function. In fact, pathologically, if the prostate enlarges, it can impede the flow of urine.
Right. Early diagnosis, it's always been said for cancer, I'm sure, almost any form of cancer, particularly prostate cancer. Tell us a little bit about prostate cancer and how it's diagnosed.
Sure. Jimmy, prostate cancer is a big deal. The shocking statistics are that 1 out of 6 men are going to develop prostate cancer during their lifetime. Tragically, of those that develop prostate cancer, 1 out of 36 are going to ultimately die of their disease. So it's a huge public health issue in the United States today.
And normally, I guess who's most at risk? I'm sure it may be all ages, I don't know, but who's most at risk?
Well, actually, prostate cancer is usually a disease of the elderly. We found that about 65% of the cases of prostate cancer are diagnosed in men above the age of 65.
Okay. Now, I think we have some potential symptoms, if I'm not mistaken, and maybe you can tell us, and I think we may even have a slide on that. Tell us a little bit about the potential symptoms of prostate cancer.
Well, sure, Jimmy. Not everyone who experiences symptoms or has prostate cancer experiences symptoms. And in fact, many times the signs of prostate cancer are first detected by a doctor during a routine checkup. However, some men will experience changes in urinary or sexual function that might indicate the presence of prostate cancer. These symptoms include a need to urinate frequently, especially at night, difficulty starting urination or holding back urine, weak or interrupted flow of urine, painful or burning urination, difficulty in having an erection, painful ejaculation, blood in the urine or semen. A frequent pain or stiffness in the lower back, hips, and upper thighs can be a symptom as well. Now, anybody who has these types of symptoms really needs to consult a physician, especially if you've had these symptoms for 2 weeks or more.
And of course, looking at those symptoms, again, there'd be other causes for those symptoms. I imagine that there are other medical things, but it's to a point to where if you have any of those symptoms, like you say, you do want to get it checked out.
That's a really good point. Most of the time, those symptoms aren't prostate cancer, but you never know. And don't forget, the earlier we pick up prostate cancer, the earlier it's diagnosed, the better chance we have to cure it.
If, in fact, I guess you find someone who's diagnosed with cancer at Terrebonne General, at the Mary Bird Cancer Center, I guess what type of treatment options are available?
Well, I've got some great news for people in this area of the country. Mary Bird Perkins Cancer Center at TGMC, if prostate cancer is diagnosed, we have very advanced radiation treatment that we can use and offer to our patients in this area to give them the best possible chance of being cured.
Okay, and what about survival rate for prostate cancer? Do we have any type of statistics, I guess, that kind of give us an indication as to, you know, if somebody does find out that they have prostate cancer, what about survival rate?
You know, there's some very good news about prostate cancer and also a profound message of hope, and that is, Jimmy, the American Cancer Society statistics are that if you catch prostate cancer early enough, survival, in other words, the ability to cure it, close to 100%.
Oh, very good. That's definitely good news, absolutely. Now, what about screening at the Mary Bird Cancer Center, TGMC? What type of screening is available, and do y'all perform it?
Yeah, screening, as we've discussed, very important to get prostate cancer as early as possible when it is as curable as possible. TGMC is actually holding a prostate cancer screening in the very near future. Actually, the screening will be September 22nd. It'll be from 10 a.m. to noon, and then again on September 22nd from 1 o'clock to 4 o'clock. This will be located at the TGMC Medical Atrium Auditorium, and this is very important. For this screening, you have to make advance appointments in order to be screened on September 22nd. You can call if you would like to be screened, and I'd sure encourage your viewers to consider this. For screening, please call 888-616-4687, number on the screen.
All right, very good. And just curious, the screening, what does that consist of?
When we do the screening, believe me, we're going to do it right. We're going to screen for prostate cancer with the best blood test for screening, which is called a PSA blood test. It can pick up prostate cancer very, very early. And in addition to that, during our prostate screening, we're going to have a physician perform an examination as well.
Okay, very good. And that's certainly a great service, to the community, great thing that you guys offer over there. And I know you have some exciting things happening at the Mary Bird Center. And I think it's important for the audience to know that the center is there. It's operational. The nuts and bolts of you guys and your staff and the equipment is there, but there's bricks and mortar going up that's even going to make it more advanced.
You know, it's part of TGMC's commitment to fight cancer now as well as far into the future. We're building a huge brand new cancer center. It's really going to be the premier location for cancer treatment in this area. We're going to have all the oncology services right under one roof. Opening, we're still expecting it to be May 2011, and it's going to be part of our commitment to help assure that if you get cancer in this area of the country, you don't have to leave this area to get the best cancer treatment possible.
Well, very good. That's exciting news. We certainly appreciate it. Want to thank you very much for coming out and sharing the awareness, and keep up the good work, Doctor.
Thank you very much for those kind words.